When a pregnant woman drinks alcohol, some of that alcohol passes across into the placenta and onto the fetus via the bloodstream. The body of the developing fetus can't process alcohol the same way an adult does and relies on the mother's liver to break down the alcohol. Because it is being passed on through the mother's body, the fetus is at risk of not getting enough nutrition and oxygen. This disorder, resulting from the exposure to alcohol in the womb, can be mild or severe depending how much and how often the pregnant woman consumes alcohol during her pregnancy. It is also affected by environmental factors, health, age of the mother, and the availability of nutrition. In Australia, the medical diagnoses associated with fetal alcohol exposure include fetal alcohol syndrome, FAS, partial fetal alcohol syndrome, PFAS, alcohol-related birth defects, ARBD, alcohol-related neurodevelopmental disorder, ARND. There is an overarching category called Foetal Alcohol Spectrum Disorder, FASD, which refers to all of these effects as a whole. Alcohol-related neurodevelopmental disorder is referred to as the invisible disability, as it often goes undetected. The representation of problem behaviors and the absence of typical physical traits will result in assumptions about the individual. Assumptions are detrimental to the student and can result in the teacher underestimating the student. A teacher should aim for helpful strategies based on knowledge of fetal alcohol spectrum disorder, such as knowing alcohol-related neurodevelopmental disorders are a brain-based condition with behaviors as symptomatic of the brain and can have significant mental defects, while alcohol-related birth defects relate to the physical characteristic traits, which may be signs of having limited mental defects in comparison. Fetal alcohol syndrome is considered the most serious end of the spectrum and is the only diagnosis within the spectrum that carries all traits. That is, characteristic facial features in addition to the neurodevelopmental and neurobehavioral symptoms that affect individuals across the spectrum. Though the spectrum is wide, each effect is undoubtedly related to alcohol abuse during pregnancy.
FASD has long-term effects and presents itself in different ways from the fetus to the growing child. The effects of alcohol on the fetus can include harm to the development of the fetal nervous system, including the brain, undernourishment of the growing baby, and changes in the development of the baby's face, resulting in the typical FASD facial features. It can also cause heart problems, kidney defects and abnormalities, as well as deformed limbs and fingers. There are many distinctive features children with FAS may have. Children with FAS often have wide-set eyes, an exceptionally thin upper lip, a short, upturned nose, and a smooth skin surface between the nose and upper lip. Deformities of joints, limbs and fingers, slow physical growth, vision difficulties or hearing problems, small head circumference and brain size, heart defects and problems with kidneys and bones.
Students suffering from FAS can have social and emotional ramifications such as the ability to receive and express language in a way considered normal. Students may become easily confused by not understanding the language used in discussions. They may also suffer from short attention spans, which can have adverse effects in conversations and activities, being that students may become bored, uninterested, or distracted by passing objects or noises. Aside from these effects, social skills and behaviors may be hard to grasp, such as having poor judgment and a lack of identification of social cues.
Various research has found that there are adverse effects to a child's ability to learn. When the memory capabilities of an FAS student were compared with a Down syndrome student, it revealed that FAS students were more limited in their memory. FAS students' retention and recognition memory are still relatively intact, but to gain the knowledge initially is a struggle. These students also have behavioural problems that may come and go, but it can be perceived as straight-up misbehaviour, though they are actually signs of their typical neurodevelopmental issues. As such, it can be seen tiresome for educators or even experienced teachers. In simple circumstances, such as trying to give the student positive feedback, the student may accept the feedback one day, but respond negatively on the second. This could be attributed to their inability to adjust to new and unfamiliar situations. These kind of responses can leave the teacher misinterpreting the student's behaviour and retorting negatively, creating a bigger issue for both the student and teacher.
Created using Powtoon.